got my report. Okay, so little problem with the editing process. The main claim has been subtly changed and somehow I didn't get from my computer to print out. So be aware of that and I'll update you. Okay, so I'm here to talk about why UCLA is way better than Okay, I'm here to talk about drug addiction. And specifically, I'm going to make a claim that drug addiction treatment is more effective way for society to combat drug and drug-related crime than incarceration. Okay, so let's just look at a few definitions around drug addiction. First of all, the DSM, or the Diagnostic and Statistical Manual of Mental Disorders. Thought I was going to just screw that up, I did. Lists 3 major symptoms of drug addiction, a third of which is frequent legal problems. Drug-defined offenses, meaning violations of laws prohibited or regulated the possession, use, distribution, or manufacture of illegal drugs. Drug-related offenses, meaning offenses that were committed under the influence of drugs. Okay, now the key element in my claim, drug addiction treatment is more effective form of preventing drug crime, more effective way for society to combat drug and drug-related crime than incarceration. The word effective, so let me define that in terms of my argument. Effective means that treatment provides successful recovery from addiction. Effective means that treatment provides successful social rehabilitation. Effective means that treatment leads to a lower rate of recidivism. Effective means that treatment programs are more fiscally sound than jails. Okay, so claim 1. Drug addiction treatment is a successful method for recovery from drug addiction. Okay, so back to the American Psychological Association, who make the DSM, the Diagnostic Statistical Manual of Mental Illness. So they have included drug addiction in their general book listing all mental illnesses. Therefore, drug addiction can be thought of an illness and has a treatment. The treatment recommended by the American Psychological Association there are a few suggestions. Among them are the pharmacological treatments, including drugs like methadone and other drugs that help relieve the side effects of withdrawal from drugs. And then also the psychosocial methods of treatment, including cognitive behavioral therapy and most recognizable 12-step programs. Drug addiction treatment is as successful as treatments for physical illnesses, including diabetes, hypertension, and asthma. And both have a relapse rate of about 50%. Drug treatment settings, according to the American Psychological Association, the places for people to best receive drug treatment, patients should be treated in the least restrictive setting that is likely to be safe and effective, like a hospital or a treatment center, and obviously not a jail. Okay, drug treatment leads to successful social rehabilitation versus prisons. A case study done by the Washington think tank, the Justice Policy Institute, looked at 2 different drug treatment centers and reported that graduates of these centers are 3.5 times more likely to be employed than before they were arrested. That's 92% were employed after they graduated. Following a year of treatment, before completing the treatment, they had a 25% greater likelihood of becoming employed than before they entered the treatment. Also, these programs reduce homelessness and increase independent living, and they also rebuild family relationships. So social rehabilitation is also a result from drug treatment. Third claim, people who have received help through drug rehabilitation programs have a lower recidivism rate. So the California Department of Corrections and Rehabilitation has stated in their annual outcome evaluation report that the combination of in-prison substance abuse treatment programs and aftercare resulted in the best outcome and recidivism rates that are much lower than those who do not participate in this treatment. So the California Department of Corrections is saying that this is the best way to do it. And also the U.S. Justice Department, comparing statistics of recidivism rate, show that people who received treatment were at 33% more recidivism versus had a recidivism rate of 33% versus 27% people who received treatment. So that's that. Fourth final claim, implementing drug treatment programs are more cost effective. Back to the case studies of the two treatment centers. The cost of treatment center was around $32,000 for a single patient, which compared with the $64,000 of a typical incarceration period for a person imprisoned for drug crimes. Okay, so what about the justice? Well, the argument can be made that these people are mentally ill, and it's standard for our American justice system not to imprison mentally ill people. So you can think that argument can be made. You can think of it like that. So in conclusion, treatment is successful when you look at when you compare this drug addiction with other physical illnesses. Rehab helps society. Recidivism is lowered after drug rehabilitation, and it is less expensive for everyone in society. So thank you.
All right, Daniel, the proposition's clearly identified, but it's got a whole bunch of dependent clauses in it, which makes it a little bit complicated. I did think that you gave us some good background on the issue of drug offenses, and you give us a long definition of what is the standard of effectiveness. The problem is that that takes up almost 2 minutes of the speech, so by the time you're getting to the body of your speech, you've really used up a third of the time that you have allocated, and so you're going to have to simplify the as if you were doing it again. It would have been better to simplify the argument a little bit more to some of its essential nature. I think that the goal there of the background definitions is admirable, but because it takes up so much time, that's a complication. Now, you labeled the first secondary claim pretty clearly. I think you do spend a lot of time describing what treatments consist of rather than assessing their effectiveness. There is some data on effectiveness, but some of the comparisons were a little bit strange. I was wondering why we were looking at the effectiveness of treatment for non-drug related illnesses like diabetes and looking at that in comparison to the drug treatments. It seems to me that the comparison that you want to be making is to imprisonment or incarceration, whether it's in jail or in a prison, and what the outcome is for people who are drug dependent in those situations. If you can say, for instance, that people in those situations come out and they are, have a recidivism rate of 85% going back to their drug use, but those who got treatment, it's only 30% or 50%, then we can see that there's a substantial difference. I thought the comparison to the other things just was confusing. You did have some data on that last point that did talk about that kind of thing, the difference, and there was also an argument about the cost issue on the last point, and I thought that, like I said, that goes back to your issue of effectiveness. You're trying to cover a whole variety of things here. Everything just needs to be tightened up a little bit because you're going in a lot of different directions on each of these individual points. The argument is that that imprisonment fails to effectively treat these things, that there are effective treatments, and that if we use those instead, that there would be better outcomes as a result. That's basically what your argument consists of. I thought that your summary had a better explanation of what the argument was than you had at the beginning or in the body of the speech. And if you went back to that summary and you said, well, let's use that as the basis for making the argument, it would be a lot clearer. As it was, it just seemed like there's a lot of disparate information that's being presented and it needs a little bit more focus. In the end, you help yourself a lot, I think, with the summary, because I think it really does make the argument clearer for us at the end. All right, thank you much. I appreciate that.